Hello everyone, I am Dr. Richa Singh, Senior Consultant IVF at Max Hospital, Panchsheel. Today I am going to talk about a very important topic, when do we need IVF? Why this topic? Because I have seen many couples have been advised for this treatment, but they take a lot of time in deciding, and by the time they decide, it's already so late that they lose their reserves. So today we would be discussing about this topic so that those couples are benefited and they can decide upon early about their treatment. So the most important indication if we talk about is a maternal age. Maternal age, it's a very important factor because in a life of woman, the moment she crosses her age of 30 years, her reserves of her ovaries start decreasing. And the moment she reaches 35, the reserves decreases rapidly and her chances of pregnancy and conception are drastically reduced to only 20%. And on more advancement, the moment she reaches 40, her chances of conception are only 5%. So if any of the couples where women age is increasing and it's more than 35 years, one should definitely consult an infertility expert for a treatment option of IVF. Another factor where an IVF is indicated is multiple IUI failures. IUI is an intrauterine insemination, a procedure which is usually adopted by couples to increase their chances of pregnancy. But many couples, they keep on undergoing cycles of IUI, even more than 6. So my suggestion is that if any couple has gone through an IUI and have failed their 3 cycles, then they should consider IVF as an option. Another factor is the duration of infertility. Many couples, when they are trying to conceive, are not able to do so in 1 year of their married life. Then they undergo investigations, and once those investigations are normal, they keep trying naturally. It's good, but one should know till when. The duration of infertility increases for more than 2 years or 3 years. One should definitely consult an expert regarding an IVF option because this is called as an unexplained infertility. Unexplained infertility is a major cause for infertility and is a major cause for consideration of IVF. Another indication for IVF is a tubal block. When the tubes are blocked, then the meeting of the sperm and the ova cannot take place to form a baby, which leads to, again, inability for a couple to conceive. So in such cases, one should consider IVF as a treatment option. In this, I would like to specify, many people are coming to me and they ask that can surgery be a resolution to it? So for that, I would just suggest that the success rates of the surgeries which are required to open the tubal blockages depend upon the site and the nature of the block. So you should always consult an infertility expert whenever there is a tubal blockage for a further treatment options. Next factor which is becoming nowadays a very much indication for landing up into IVF is polycystic ovary syndrome. It's a disorder and a hormonal imbalance in a body of a female where she has inability to conceive. Apart from that, has irregular menstrual cycles, development of facial hair and weight gain. The major problem is the hormonal balance is so much so that her ovulation functions are hampered and she is not able to conceive. So in such cases where the medications have failed, she has tried with other drugs and it's not working, one should consider IVF as an option. Next factor which is important indication for IVF is endometriosis. Endometriosis is a kind of problem where the whole anatomy inside the body to help in conception is disturbed. It might cause a lot of deposits inside the uterus or outside the surfaces of uterus, can cause attachment, plus it many a times causes chocolate cyst or a cyst in ovary. And many a times when operating on such cyst, the part of the ovarian tissues are also removed, which further decreases the ovarian reserve. So a couple who is undergoing a treatment and have been diagnosed as endometriosis should definitely consult an infertility expert regarding this treatment option. And last but not the least, most important factor is male infertility. So, if a husband has gone under a semen analysis and has been found that no sperms are present in the semen, or if the counts are very low, the motility is low, and the morphology is not good, or if he is suffering from any sexual or erectile dysfunctions, then one should consult an andrologist or an infertility expert for considering of IVF as an option. So, if any of these factors are present and anybody is suffering from those, one should always consult an infertility expert. Take an opinion and decide to take a treatment early in your stage of life so that it's never too late. Thank you for watching this video. In case of any queries, consultations or second opinions, you can reach me. Thank you.